Greetings, this is your Senator Ken, and this is the Constituent Report. Today I have a very special guest who's going to talk about licensure for diabetes educators. And my special guest is Miss Gail Richardson. She's a nurse practitioner and certified diabetes educator.
Hi, Senator. Thanks for allowing me to come and speak to you today.
Gail, I attended a nursing forum at the State Nurses Association 2 weeks ago, and state licensure for diabetes educators was discussed. Now, Gail, I ask you to come and speak to me today and as constituents there in the audience because I am interested in hearing more about this issue. Now, can you provide me with some information on why this issue is important to my constituents?
Sure, I would be happy to discuss this issue with you, Senator. I am a nurse practitioner and a certified diabetes educator. This issue is currently being evaluated by several states. Every day, 5,082 people are diagnosed with diabetes. Almost 26 million Americans have diabetes. 7 to 9 million Americans have prediabetes. Diabetes is a complex, costly, serious disease. It is the 7th leading cause of death in the state of Georgia. Diabetes is the leading cause of kidney failure, lower limb amputations, and blindness. It is also a significant cause of heart attacks, strokes, high blood pressure, and nerve damage. 1 out of every 10 healthcare dollars is spent on diabetes care and its related complications. Each year, $174 billion is spent on diabetes care. This includes medical costs, disability, work loss, and premature death. Diabetes education plays an essential role in the management of diabetes, and it is well known that patients who receive diabetes self-management education and training have fewer complications. So it is imperative that healthcare professionals who deliver diabetes education to people with diabetes are well educated and appropriately credentialed. Currently, there is no legal definition or scope of practice for the practice of diabetes educators. Diabetes educators are self-defined, and any healthcare provider can say that they are a diabetes educator without meeting any minimum or quality standards to do so.
But can't diabetes educators obtain certifications as diabetes educators?
Yes, diabetes educators can obtain the Certified Diabetes Educator and Board Certified Advanced Diabetes Manager certification for recognition as a diabetes educator, but these certifications or credentials are voluntary and they are not required for the practice of providing diabetes education. Besides, credentialing or certification is a non-statutory process for which an organization grants recognition to an individual for having met predetermined professional qualifications. Licensure, on the other hand, sets minimum quality standards and the scope of practice for the diabetes educator to ensure that all healthcare providers who practice and deliver diabetes education will have the adequate and competent knowledge to provide safe, effective care to persons with or at risk for diabetes.
Oh, I see.
Kentucky signed a bill into law March 16, 2011 that requires a professional state license to practice diabetes education. Many other states, including Indiana, Pennsylvania, Florida, Georgia, Mississippi, New York, and Maryland, are also considering similar legislation within the next year or two.
Should we ask all healthcare providers who discuss education about diabetes to acquire a license to do so?
No. Licensure for diabetes educators is intended for healthcare professionals who have a defined role as a diabetes educator, and not for those who perform only a few diabetes-related functions as part of or in the course of their other routine occupational duties.
Oh, I see.
A license for diabetes educators defines the profession of diabetes educators. It also sets a legal scope of practice for diabetes educators and require that diabetes educators meet minimum qualifications to deliver quality diabetes education.
So, what other advantages does licensure provide, Gail?
Licensure for diabetes educators have many advantages. First and foremost, we want to protect our patients. Licensure will ensure that the education patients receive is provided by qualified professionals with appropriate training skills. It also sets a legal definition and a codified scope of practice or license for diabetes educators. It sets quality guidelines and provider qualifications for the profession. It opens the door for negotiation with Medicare and private insurers for the recognition and reimbursement of diabetes education and training services for all professional diabetes educators. It allows for recognition of diabetes educators as qualified providers and eligibility for reimbursement of services from the Essential Health Benefits package of the Affordable Care Act. It also provides professional recognition for the practice of diabetes educators and encourages growth in the profession by opening up other employment opportunities.
Thank you very much, Gail. This information was very helpful in helping me to move forward in discussing this issue with my other colleagues. Now, may I contact you for more information on this issue as I need it?
Of course, I am a Doctor of Nursing practice student at Duke University. Feel free to contact me at any time. Also, here's a list of websites for your reference.